would you say that once somebody's labeled as having PCOS, will that be defined for life? Like we're talking about, okay, their genetics is there, they have a predisposition, and then with diet and lifestyle, ultimately they ended up having PCOS. Would we call them PCOS for life then?
I think that from the patient's perspective, that once you have a diagnosis of PCOS, you know that your risk factors for chronic disease, including diabetes, heart disease, depression, all those things are increased. And so I think that women should say, I've had a diagnosis of PCOS. I should be screened appropriately, think about my life that way, have my lifestyle be in a way that's protective. I think they should do that forever. I think the problem with PCOS, and when I see patients that come in, there's often a lot of confusion. Like people will say, well, someone told me that I have PCOS, but then someone said that I don't have PCOS. And it's not like the diagnosis of diabetes where you have like one level
That
basic
defines it.
criteria. You have a hemoglobin A1C over 6.5, you're diabetic. So PCOS is a diagnosis of exclusion. And so you have to have two of three clinical features: irregular cycles, elevated male hormones that could be in blood work, or symptoms like acne, oily skin, or increased hair growth, and then polycystic appearing ovaries, either on ultrasound or with the new diagnostic criteria, they've added some AMH blood testing that can also fit that criteria. You have to have two of the three, and then we have to exclude all the other disorders. So let's say someone comes in, they have irregular cycles, polycystic appearing ovaries on ultrasound, and we've ruled out all of the other impersonators. So diabetes, thyroid disorder, prolactin issue, hyperplasia, adrenal hyperplasia. So they have a diagnosis of PCOS. Now, let's say that that woman loses weight. She uses a GLP-1, or she modifies her diet, she's exercising, and she starts to ovulate regularly. Now she has lost a diagnostic criteria because she has regular cycles. Does she not have PCOS anymore? Based on the criteria, she doesn't, right? But that doesn't make any sense. She has modified her lifestyle so that now she's ovulating, but she still has PCOS. So it really can be very confusing because women present to their providers at different stages of their life, and they may or may not fall into the criteria at that time. And the other thing is there's a lot of overlap with obesity, diabetes, and PCOS. And so because there is so much overlap in the pathophysiology of insulin resistance, obesity, inflammation, and PCOS, sometimes it's very difficult to tease out what they have. Now, after practicing fertility medication or medicine for 20 years, I'm pretty practical. And a lot of times I'll say, your presentation is a little confusing, but ultimately it probably doesn't matter. You still need to do the same things for your lifestyle, and I still need to do the same things to help you ovulate, to help protect your uterus, to treat your blood sugar. So I think it's a complicated diagnosis, and it's kind of complicated throughout our life. But it's something that women should be aware of, and our providers should be aware of, and they should be screened appropriately throughout life.